Install the flip-out field desk. Remove front panel and attach to side. Fold down legs to form desktop. Bring in the surgical bed container. Unpack the surgical bed container. Keep items from each tray grouped together. Repack the container trays. Latch container and move container out of tent. Attach the 4 short connecting rails to the inside of the table legs. Attach 4 additional connecting rails to the structure. Slip mesh bottom shelf sling over side rails. Slip middle fabric shelf over other side rails. Position table end frame and click into place. Turn table, mesh bottom shelf sling side down. Move surgical table into final position. Ensure table feet are firmly attached. Unroll top and bottom fabric slings and attach both to each end of table. Snap stretcher rails into top of OR table legs. Place mannequin on litter and install on top of OR table legs.
The surgical trays, they're filled with ortho and the minor basic surgical tools that a general surgeon or an orthopedic surgeon would need to perform operations. We have the Zoll M series. It's a defibrillator. We're used shock, and then it also has 12 lead capabilities, so we can read heart rhythms. We have the Drager. The Drager always sits at the head of the table, so they can put on the breathing mask. This is what will put the patient to sleep, so that they can. Beneath the patient's head, we have our suction, ventilator, and our ProPack monitor.
So on the left side of the bed, on the upper left side of the bed, you're going to have the dry seal chest drain, and what that works with is you're going to push fluid inside of it. It's going to create that negative pressure. So when this patient is getting a chest tube put into him, it's going to actually start draining the blood there, and it actually has check marks on the side of it, so you're going to know how much blood they're actually losing.
So we have our trauma hanging bags, either ACU, coyote tan, or a black pattern. They'll be used for our HAPCs, or our hemorrhaging, airway, breathing, circulation. They'll have interventions inside, medical equipment that you could use for that certain injury whenever they're going along and through their assessment. There'll also be a person able to grab equipment as needed from the trauma hanging bags during the operation. On the left-hand side of the table, in the midsection of the patient, we have the Belmont blood infuser. Inside, it actually has a heating coil so that the blood can be warmed as it enters the body.
Now the exhibit is complete. Be confident going into your event. Whether your audience is pre-health students or fully qualified healthcare professionals, they'll be drawn to the exhibit and eager to learn more about the Army Healthcare Team. Be sure to utilize the Army SMEs. And be excited, this is a great opportunity for us to bring healthcare professionals in the United States Army Healthcare Team.